The title of my speech is Lily, Preventing Medical Mistakes, Part 4. So I hope that you were able to be here for the Part 1 and Part 3 so that this Part 4 makes a little bit more sense. In the Philippines, it's tradition for a mother to fly to where her daughter is when she gives birth to a baby. So, September 2011, I flew to Annapolis, Maryland to meet my first grandchild, Lily. Back in the days, mothers delivered babies in a delivery room, and the babies are taken to the nursery. In the last decade or so, that is no longer the case. Mothers deliver babies in the hospital bedroom, and the babies stay with the mother in that room until the mother is discharged. Normally, the mother is discharged after 2 or 3 days when everything is fine and there are no other medical conditions of the mother. Nowadays, the mother is discharged on the day of delivery if everything is normal. So things have changed, and it's all about cost containment in the hospital. And of course, the insurance companies love to save money. When Lily was born, she had jaundice. So when my daughter was discharged on the 3rd day, she was transferred to neonatal intensive care unit so that she will receive phototherapy light to lower her bilirubin level, and then she can be discharged home. This normally takes about 3, 4, 5 days for the baby to get back into the normal bilirubin level. On this 3rd day, when I walked to the neonatal intensive care unit in the 3rd floor of the hospital, I saw Lily in that incubator, and I saw my daughter 7 feet away sitting on a chair, and she was just so tired from that labor and delivery from 3 days before. And so I asked her, everything looks fine, so I asked her if she wanted something to eat for breakfast. And she said no, but I needed to eat. So I decided to go to the cafeteria, which was on the other side of the building. This is like a 375-bed hospital, so you know it's huge. Took the elevator, went down to the cafeteria, decided on pizza for breakfast, and as I was getting ready to sit down, someone above nudged me, go back to the intensive care unit. You know, I don't get a lot of nudges like that. So I obeyed. So I started walking back to the ICU, eating my pizza along the way. Isn't that funny? When I got to the room, I saw Lily in the incubator in drowning motion, both hands and feet. And milk was coming out of her nose and her mouth. I looked at the monitor and it was bad. Lily couldn't breathe. You know this, Trish, you're an ICU nurse, right? So I panicked because it has been like 36 years since I went into rotation in an ICU. And I didn't know how I could save Lily in that incubator. How can I open that incubator? I can't remember. I looked at Jean, my daughter. I said, Jean! And Jean was startled. She looked at the monitor and she saw something was wrong in that monitor. And she ran to the door and she yelled, we need help here! And here I am. While she was doing that, I inserted 2 of my hands in those holes in the incubator. And I turned Lily to her side and I suctioned, you know, they have this little suction, and I suctioned her nose and her mouth. And I prayed to God that it was not too late. And then the nurse came in and she said to my daughter, you didn't have to yell. And then she took over. And I just stood by and I'm looking and I'm thinking in my head, oh my God, had I not walked in at the right moment, Lily would have suffered from respiratory arrest and eventually cardiac arrest. A 3-day-old baby having a heart attack. I was so upset and so mad. 10 minutes later, The nurse taking care of Lily, assigned to Lily, walked in, didn't have any idea what was going on in the room until the other nurse told her. And when the first nurse left, she said, "I am so sorry. I am too fatigued from working 2 full-time jobs. I forgot to hook up Lily to the monitor in the nurse's station so somebody could see if she is in distress." And I'm thinking, oh my God, my mother just died 3 years ago, and here we are. This baby could have died. And because I am an advocate for everybody, young and old, babies and senior citizens, I vowed to myself that I have to do something about this. So I requested to talk to the head of NICU. Oh, he tried to avoid me that day, and the 4th day, and the 5th day. And all the more, I was so mad because I wanted him to take action for this thing not to happen again. Because nobody knows how many babies have died in that NICU. Nobody. Because these reports are usually hidden so that the public will not know about it. When finally this head of the ICU, a doctor, walked in the door, he was already ready to, with his defense up here, and said, well, it takes 15 seconds for the monitor to send a message to the nurse so that the nurse knows that the baby is in distress. And I'm thinking, but where was she? She didn't show up until 10 minutes later. Apparently, she didn't turn that thing on either, because apparently nurses now, ICU nurses, they have this machine, like a cell phone that they can carry with them, and it will notify them if the baby is in distress or a patient in the ICU is in distress. Long story short, this doctor did not even apologize for the mistake of this nurse. And to me, that was really negligent and very careless of that nurse. And he said, "Do you want to go home? I can discharge Lily right now." And I'm thinking, oh my God, now he wants this baby to go home and her bilirubin level is not normal yet. And he discharged Lily. Good thing I grew up in a third world country where I know I don't have to use an incubator to cure Lily's bilirubin. You just expose the baby to sunlight before the 10 a.m. sunlight, between 7 and 10 a.m., expose her skin, and it will help reduce that bilirubin level. But we were instructed to report to the hospital every day to get her blood tested for bilirubin level. Long story short, after I had settled down a little bit, it took a month or 2, I was so distressed about that incident. I wrote the medical director of the hospital to report the incident, but I didn't receive any response, and that was very distressing to me. So how do you prevent these kinds of incidents, medical mistakes and medical errors, from happening to you, your children, your parents? Number 1, I've mentioned this before, don't just surrender when you are in the hospital. Especially when you are in ICU, most patients are not even alert, right? You need to be there, have a friend, a relative, member of your family watch you in the ICU, because guess what? I have many nurse friends who worked in the ICU, and we often joke with each other. Even if you put a $5 bill or a $20 bill under the patient who is unconscious on a respirator, you come back 12 hours later because the shift is 12 hours. You come back 12 hours later, and that patient is still in the same position, and the $5 and the $20 bill is still there. What does that tell you? It's bad medical care. Not all nurses are created equal. There are some good nurses and there are some bad. Be present when you are in the hospital. Have someone advocate for you, because with lack of experience from nurses, lack of education, lack of training, nurses now They get an RN title after they pass the exam, but they have only gone to 2 years of nursing school. You can't learn much in a 2-year. I went to a 5-year Bachelor of Nursing program in the Philippines. We were trained, we had skills. I delivered 20 babies before I could graduate. That kind of stuff. 2 years of education is not good enough. Lastly, a lot of nurses, even doctors, are burned out. And you need to be prepared when they are burned out, and most of them are already in an older stage. They are burned out, and so they just, they don't put in what 100% in their jobs. So those are the things. Be present, or have someone be present for you, especially when you are in the ICU, because not all doctors, not all nurses are created equal. Thank you.